So, what's the thing called a cervical disc or a lumbar disc? 4 point of anatomy. The spine is divided in cervical spine, thoracic spine and lumbar spine.
The thoracic spine is your higher back, and it extends from T1, thoracic 1, to T12, thoracic 12. Your lumbar spine extends from L1, lumbar 1, to L5, lumbar 5. The end of your backbone is where your sacrum is.
The sacrum consists of 5 fused bones into one massive bone. The discs are located between each bone of your cervical, thoracic and lumbar spine. A disc divides the bones of your spine, the skeletal structures.
During your waking hours the discs leak water, due to gravity effects. When you sit you are adding weight to the backbone of the disc and water comes out. The water is revived into the disc, when lying down, etc., but it is revived at a slower pace.
When somebody starts aging, the fat and water within the discs go from thick to thin, and this can cause degenerative disc illness. The loss of liquid from your backbone is a leading reason for back trouble, particularly at the lumbar area. The annulus fibrosus makes up the marginal portion of the disc structure. The inner area of the disc is protected by the nucleus pulposus.
The pulp makes up the heart of the disc, which is polished and soft. The discs make up the first supporting force that regulates the spinal column, muscles, bones, and so on.
The annulus fibrosus is made of cartilage and collagen, connective tissue. A disc tear takes place when there's an interruption of the annulus fibrosus and the disc starts leaking. This liquid can irritate the encompassing ordinary tissue around the disc.
At times the connective tissue led to aberrant thickening, creating scars. A thin layer of scar tissue at the periphery of the tear may seal the leak of liquid but leave the disc subject to re-tearing.
An annular tear is more frequently than not due to an injury that increased the intradiscal pressure.
Will spinal decompression help in the case of a disc tear? Spinal decompression appears to be better in treating cases of lumbar herniated discs than on cases of disc tear.